Welcome to this video on the 2 basic options when it comes to Medicare. This video does not cover every Medicare-related situation, just the basics. Consult with your state-licensed, Medicare-certified, independent agent for more information on your specific situation. So let's begin. So here is what you'll learn. First, review the different parts of Medicare. Next, compare original Medicare versus Medicare Advantage, including monthly premiums, out-of-pocket costs, and plan benefits. Next, how to choose between Medicare and your employer group health plan. Then, explain when to use each of the 5 most common Medicare enrollment periods. Finally, list the steps to enroll in Medicare. So let's get started. First, let's start with a review of Medicare. Medicare has 4 basic parts. Part A, hospital insurance. Part B, medical insurance. Part C, Advantage plans, and Part D, standalone prescription drug plans. These are health insurance plans that cover your medical and prescription drug needs. Medicare Part A and Part B are administered by the government. Medicare Part C and Part D plans are offered by private insurance companies and subsidized by Medicare. In addition, there are Medicare supplements or Medigap private insurance policies offered by insurance companies that cover the costs that Part A and Part B don't cover. For details, watch the video on Medicare Basics Parts A, B, C, and D explained on our YouTube page. Now, let's start by learning more about your 2 basic Medicare options. First, Option 1. Original Medicare Parts A and B+. This includes Original Medicare Part A, hospital insurance, and Medicare Part B, medical insurance, plus a standalone Medicare Part D prescription drug plan, plus an optional Medicare supplement or Medigap, in this example, Plan G. Next is Option 2, Medicare Part C Advantage plans, offered by private insurance companies, which covers the same Medicare-approved services as original Medicare Part A and Part B and Part D, plus includes supplemental benefits not covered by original Medicare. Next, let's look at the monthly premiums under each option. Under Option 1, Original Medicare A and B+. Part A, hospital insurance. It's typically at no cost for most beneficiaries if you paid FICA payroll taxes for at least 10 years or 40 quarters. Next, Part B, medical insurance. Monthly premiums in 2026 are $202.90 per month. Next is IRMA, the income-related monthly adjustment amount. It's a surcharge on Medicare Part B and Medicare Part D. It's based on your modified adjusted gross income. In year 2026, it's based on your 2024 tax return. The IRMA surcharge is in addition to your Medicare Part B and Part D premiums. To learn more about IRMA, see our video on 2026 Medicare IRMA explained on our YouTube page. Next, Medicare Part D standalone prescription drug plan premiums. Monthly premiums vary by plan and insurance company. Finally, monthly premiums for Medicare supplements or Medigap plans. Monthly premiums vary by a person's age, plan type, and insurance company. Now let's review Option 2, monthly premiums for Medicare Part C Advantage plans. Monthly premiums for Part A and Part B, plus any IRMA Part B and Part D monthly surcharges still apply to Medicare Advantage plans. Next, Part C Advantage plans. Monthly premiums vary by plan type, plan benefits, and insurance company. Next, Part D prescription drug plan premiums. There are no separate monthly premiums. They are included in the Advantage plans. Finally, Medicare supplements or Medigap plans. There are no premiums. It's illegal to have a Medigap plan plus an Advantage plan at the same time. If you enroll in Medicare Part A and Part B only, but not Social Security, then you'll receive a quarterly bill from Medicare for 3 months of premiums on Part A and Part B. If you are a high-income earner, then you'll pay additional IRMA Part B and Part D surcharges. Once you enroll in Social Security benefits, then these charges are automatically deducted from your monthly Social Security deposit. Now, let's look at the out-of-pocket costs associated with both Medicare options. Under Option 1, Original Medicare Part A and Part B, Plus. For Medicare-approved services. In 2026, your total out-of-pocket costs is $283, using a Medicare Supplement or Medigap, Plan G. After the $283 annual deductible, all medical costs are covered 100%. For prescription drugs. In 2026, using your Medicare Part D prescription drug plan, the maximum out-of-pocket costs for prescription drugs is $2,100. Next, under Option 2, Medicare Part C Advantage plans. The maximum out-of-pocket costs for all Medicare-approved services depends on the specific Medicare Advantage plan. There may be deductibles, copays, and coinsurance you'll pay along the way. Next, using the Medicare Part D prescription drug plan in your Medicare Advantage plan, the maximum out-of-pocket costs for prescription drugs is $2,100 in 2026. Remember, the maximum out-of-pocket costs for prescription drugs is separate from the medical maximum out-of-pocket costs in the plan. Now, let's look at the benefits of each Medicare option. Under Option 1, Original Medicare Part A and Part B Plus. First, the cost of care is generally 40 to 50% less than a private health insurance plan. Next, there are no networks. You have nationwide coverage with any provider that accepts Medicare. Then there is no pre-authorization for Medicare-approved services. Next, if you use a Medicare Supplement Plan G, all medical services are covered 100% after a $283 annual deductible. Also, you pay no more than $2,100 in out-of-pocket costs for all your prescription drugs in 2026. However, you will have higher monthly premiums by adding a required standalone Part D drug plan and an optional Medicare supplement plan. Now, let's look at Option 2, Medicare Part C Advantage plans. First, the cost of care is generally 40 to 50% less than a private insurance plan because of Medicare rates. You must use the insurance company's network of providers for in-network services. Pre-authorization may be required for some services. Next, you may pay more out-of-pocket on medical deductibles, copays, coinsurance, and maximum out-of-pocket costs along the way. Remember, the prescription drug maximum out-of-pocket of $2,100 is separate from the medical maximum out-of-pocket costs in the plan. Finally, monthly premiums will be lower when compared to Option 1. Finally, regarding the supplemental or extra benefits, these are additional benefits offered by Advantage plans that Original Medicare Part A and Part B don't offer. These benefits include routine dental, vision, fitness, over-the-counter items, meals, transportation, and Part B giveback. These extra benefits vary by Advantage plan and where the plan is available. Medicare may not be the best option if you are currently on an employer-sponsored group health plan. So, how do you decide between Medicare and your employer group health plan? The answer is compare the benefits. When might Medicare be a better option? First, Medicare sets the prices for all Medicare-approved services. Generally, the costs can be 40 to 50% less compared to your employer plan. Second, with Original Medicare Parts A and B, there are no networks. You get nationwide coverage. Any provider that accepts Medicare means you're covered. Third, with Original Medicare Parts A and B, plus a Medicare Supplement Plan G, all Medicare-approved out-of-pocket costs are covered at 100% after you pay a $285 annual deductible in 2026. Next, many Medicare Part C Advantage plans or Part D prescription drug plans have low or no monthly premiums. Finally, many Medicare Part C Advantage plans have low to no medical deductibles. Medicare may be a better option when many Medicare Part C Advantage plans offer supplemental benefits like dental, vision, hearing, over-the-counter, and fitness benefits at no additional cost. Also, many Medicare Part C Advantage plans or Part D drug plans offer low to no cost on generic drugs. It's important to know that if you work for a small employer with fewer than 20 employees, Medicare pays claims first, before the employer plan. So it's important to enroll in Medicare at age 65, if you work for a small employer. It's important to know that after age 65, COBRA coverage under an employer plan, where you pay the entire cost of coverage, is not considered creditable coverage by Medicare. Or an ACA marketplace plan paid for by an employer is also not considered creditable coverage by Medicare after age 65. It means you may face Medicare late enrollment penalties for life. So, when is Medicare not the best option? First, if you are a high-income earner that is in 2024, you reported on your tax return a modified adjusted gross income of more than $109,000, filing individually, or $218,000 filing jointly. If you did, you'll be assessed an additional monthly IRMA surcharge on your Medicare Part B and Part D. The higher the income, the higher the IRMA surcharges. This is in addition to your Part B and Part D monthly premiums. Second, if you have dependents under age 65 who still need health coverage, typically through the ACA marketplace, where plan premiums are based on age and available tax credits. Third, not all prescription drugs are covered under Medicare Part C Advantage or Part D prescription drug plans. Fourth, if you use expensive prescription drugs, Medicare Part C or Part D may not be your best option. Also, Medicare may not be your best option if you currently have low or no prescription drug out-of-pocket costs. Next, Medicare doesn't typically cover experimental or non-Medicare approved treatments, procedures, or equipment. Also, if you contribute to a health savings account or HSA. Remember, once you enroll in Medicare Part A, you may no longer contribute to an HSA. Finally, if you pay low or no monthly premiums on your current health plan, Medicare may not be the best option for you. So, consult with your trusted, state-licensed, Medicare-certified independent agent to see if Medicare or your employer health plan is a better option for you. You may choose to keep both Medicare and your employer group health plan. Just remember that according to Medicare secondary payer rules, a large employer, defined as having 20 or more employees, the employer plan always pays claims first, then Medicare pays second. It may be an option if your employer plan has a high deductible that you must pay first. However, if an employer has less than 20 employees, then Medicare pays first. The employer plan pays second. So, for example, if you enrolled only in Medicare Part A hospital insurance, the insurance company may consider you entitled to Medicare even though you have not enrolled in Medicare Part B medical insurance. The employer plan may only pay claims above what Medicare would have paid, which means you may be responsible for paying those claims out of pocket. Employers may reimburse Medicare premiums on a pre-tax basis using a Section 105 Health Reimbursement Arrangement or HRA. Reimbursement includes premiums for Part A, Part B, Part C, Part D, and Medicare supplements or Medigap plans. However, it does not include IRMA because IRMA is a tax surcharge, not a qualified medical expense. So, starting at age 65, Medicare keeps track of whether you have medical and drug coverage that is at least as good as Medicare. It's called having creditable coverage. If you have any gaps in coverage, Medicare may assess late enrollment penalties for life. Many employer group health plans are considered creditable coverage, or just as good as Medicare when it comes to their medical and prescription drug coverage. So, no late enrollment penalties are typically assessed on employees age 65 or older. Employers are required to send an employer notice of coverage to all Medicare-eligible employees and their Medicare-eligible dependents to inform them whether their employer-sponsored prescription drug coverage is creditable, meaning it's expected to pay on average as much as the standard Medicare Part D plan. If you do decide it's time to enroll in Medicare, the 5 most common Medicare enrollment periods are: the Medicare Initial Enrollment Period, the Medicare Special Enrollment Period, loss of employer coverage, the Medicare Annual Enrollment Period, the Medicare General Enrollment Period, and the Medigap Open Enrollment Period. There are more enrollment periods available for very specific situations to enroll in Medicare. Individuals may only sign up for Medicare using a specific enrollment period. So, let's start with the Medicare Initial Enrollment Period. This is the first opportunity for individuals turning age 65 to enroll in Medicare. You can enroll up to 3 months before your birth month. Medicare always starts on the first day of your birth month. When you enroll, you'll receive your Medicare ID number and Medicare Part A and Part B effective dates. Once you have this information, you can sign up for other Medicare plans. The earlier you enroll, the better, so you have time to learn all about your Medicare options and choose Medicare plans that fit your specific health and financial needs. Next is the Medicare Special Enrollment Period loss of employer coverage. Assuming you'd have employer coverage, this is your opportunity to enroll in Medicare after turning age 65 without incurring late enrollment penalties. To enroll in Medicare, there is an extra step. That is, complete Form L-564, Request for Employment Information signed by your employer. This form attests that you have been continuously covered by your employer plan since turning age 65. You have 60 days to complete the special enrollment period. Next is the General Enrollment Period, or GP. It runs from January 1st to March 31st of each year. It's available for those who missed enrolling in Medicare Part A or Part B during their initial enrollment period. Coverage begins the first of the following month. Finally, once you are on Medicare, every year you have an opportunity to change plans during the Medicare Annual Enrollment Period. It's your opportunity to join, drop, or switch government-subsidized Medicare Part C Advantage or Part D prescription drug plans effective for the next calendar year. The Medicare Annual Enrollment Period begins October 15th and ends December 7th. Note that Medicare supplements or Medigap plans are private insurance policies and are not part of the Annual Enrollment Period. It's important to note that Medigap policies limit enrollment to very specific times. The main one is the Medigap Open Enrollment Period. It's when an individual who turns age 65 and enrolls in Medicare Part B has a one-time 6-month window to enroll in a Medigap plan without medical underwriting. After that time, the insurance company may ask health questions as part of its medical underwriting. Individuals may be rated up or even turned down for coverage. Because Medigap plans are private insurance policies, they are not part of the Medicare Annual Open Enrollment Period. So, how do you enroll in Medicare? The Social Security Administration is the gatekeeper for Medicare. This is where you'll enroll in Medicare. Step 1. Create an account on the Social Security website at ssa.gov. You'll need to verify your identity through login.gov or id.me. Using your real ID, driver's license, or other forms of official identification. Step 2. Choose the correct Medicare enrollment period as discussed earlier. There may be multiple enrollment periods you qualify for. Your agent can help you make sure you choose the right ones. Step 3. Complete the online application. You can apply for both Medicare Part A and B, or Part B only if you already have Part A. If you apply for Social Security benefits, you will be automatically enrolled in Medicare Part A and B. Step 4. Look for an email verifying that you have applied for Medicare and that your local Social Security office will process your application and may contact you if they need more information. Step 5. Look for your benefit verification letter on your ssa.gov account. It will have your new Medicare ID and Part A and B effective dates. This is the first place you will see your Medicare information. Later, you'll receive your Medicare card in the mail, usually in about a month. Step 6. Learn about all your Medicare options so you can choose the right Medicare plans that fit both your health and financial needs. It's best to get help from a state-licensed, Medicare-certified independent insurance agent. There is no additional charge to use an agent. Their compensation comes from the plans they represent. Step 7. Once you have your Medicare information, your agent can answer questions about specific plans in your area. For example, options, benefits, prescriptions, providers, and plan limitations. Then enroll you in the Medicare plans that best fit your specific needs. For example, if you choose to stay on original Medicare Parts A and B, an agent can help you enroll in a Medicare Part D prescription drug plan plus a Medigap plan. Or if you want the additional benefits like dental and vision, an agent can help you enroll in a Medicare Part C Advantage plan. All based on your health and financial needs. Step 8. Once you've enrolled in your Medicare plans, create accounts on each plan's website to access your benefits and pay monthly premiums. Step 9. Create an account on Medicare.gov. It's your home for all your Medicare-related information. Step 10. Your state-licensed, Medicare-certified independent agent is your resource for Medicare. They can answer all your Medicare-related questions throughout the year. For example, they can tell you about changes that might affect your Medicare benefits, or any changes to the plans you are on. All at no additional cost. Need more information about Medicare? Check out these videos on our YouTube page covering specific topics in more detail. Your trusted state-licensed, Medicare-certified, independent insurance agent can guide you through the process and help you find the Medicare plans that fit your unique health and financial needs. Remember, it doesn't cost any more to use an agent.